Pros and cons of feeding tubes in the elderly. Discover the benefits and drawbacks of feeding tubes for elderly patients with this comprehensive guide. As seniors age, swallowing food can become challenging, prompting discussions on enteral nutrition. Early consideration of this topic allows individuals to make informed decisions while they can. Having an advanced directive in place honors their wishes and eases decision-making for family members later on. Opinions on enteral nutrition vary. Some prioritize quality of life and decline artificial nutrition, while others see feeding tubes as a means to prolong life. Nursing home residents often rely on feeding tubes, requiring increased care and monitoring. An advanced directive does not hasten death, nor does hospice care. Enteral nutrition and intravenous feeding can extend the lives of older adults and critically ill patients. Enteral nutrition involves providing liquid nutrition through a tube into the stomach or small intestine. However, it should be carefully considered as one of many therapies available. The duration of life with parenteral and enteral nutrition varies depending on individual health conditions. Some, like those with advanced dementia or progressive neurological disorders, may not benefit from extended life. For head and neck cancer patients, a PEG tube can aid in nutrition during treatments, supporting healing and recovery. Research suggests that enteral nutrition does not significantly impact life expectancy for most elderly individuals without additional medical interventions. It's crucial to be informed about the pros and cons of feeding tubes and liquid nutrition for end-of-life planning, especially for those who haven't made decisions in advance. Feeding tubes can be an effective tool to help those who cannot eat or drink on their own. However, it is important to understand that oral supplements and enteral nutrition should not be used as a means of life prolongation in the elderly or those with terminal illnesses. It is important to discuss your individual needs and preferences for hand or tube feeding with your doctor, as well as consider the potential benefits of blenderized tube feeding or other blended diets. Ultimately, you have to decide what is best for you and your family. Enteral feeding tubes play a crucial role in providing liquid nutrition to elderly patients who face challenges with swallowing or digestion. Several types of tubes, including gastrostomy tubes, G-tubes, jejunostomy tubes, J-tubes, and others, offer various benefits and drawbacks. Pros of feeding tubes: provides essential nutrients and energy for those unable to swallow or digest food, helps prevent malnutrition and reduces the need for hospitalization. Various tube types, example, gastrostomy, balloon peg, flying squirrel G-tube, offer flexibility and options for individual needs. Some tubes can reduce infection rates and work in conjunction with other feeding methods. Enteral feeding pumps allow slow and consistent nutrient delivery. Cons of feeding tubes: invasive procedure with potential risks, such as infection and bleeding. Potential complications like aspiration pneumonia or edema due to mechanical feeding in the small intestine. Tube placement may require sedation for confused or agitated patients. Feeding tubes cannot replicate the pleasures of taste or social interaction during meals. Should not be used as a means of life prolongation for those with terminal illnesses. Considerations for feeding tube care: frequent monitoring and tube placement checks are necessary to ensure effectiveness and safety. Professional training and guidance, for example, PG training courses, are vital for caregivers. Careful calculations for tube feeding amounts based on individual needs and preferences. Discuss with a doctor to determine the best type of tube feedings and consider blenderized food as an option. Ask for assistance in creating a care plan for PEG tube feeding. In conclusion, feeding tubes can be a valuable tool for elderly patients who cannot eat or drink independently. However, their use should be carefully evaluated based on individual needs and preferences. Feeding tubes should not be used as a means to prolong life for terminally ill patients. It is crucial to have open discussions with healthcare providers and consider all options before making decisions about feeding tubes. The focus should always be on providing the best care and comfort for the patient during their end-of-life journey. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.